Dear friends, well-wishers and supporters of SAF USA, warm greetings and best wishes from all of us at Sankara Eye Foundation India. Over the decades, together Sankara Eye Foundation USA and Sankara Eye Foundation India could take quality eye care to the doorsteps of rural India, and it's only because of the unstinted faith and support which all of you gave us. Over 2 million free eye surgeries performed for the needy so far. Over 5 million rural patients examined. Over 6 million children tested for undetected visual defects. Yes, all of us can feel really proud about our performance, looking back with pardonable pride. As we have been steadily moving forward towards our goal of eliminating needless blindness in India, the most unprecedented and unexpected global pandemic COVID-19 has confronted us. Since March this year, our activities have slowed down, with only emergency cases being seen at our various locations across the country. There are many challenges and uncertainties posed by the pandemic. Our team, over the past several weeks, have worked together and they have come up with a comprehensive way forward. Sankara Restart. We have had to make changes in our operations, in our human resource management. Our team has to be trained and given oriented towards the new norms. We need to balance between the delicate financial resources and to continue with our patient care. There is no question of us returning back to the good old days, but we at Sankara are well prepared. We are prepared to face the challenge of the COVID-19. Safety of our colleagues who are in the forefront, as well as the safety of our patients, is of utmost importance to all of us. We have worked with manufacturers, reputed manufacturers, to procure high efficiency filtering masks for all our employees at Sankara, guidelines for triage with personal protective equipment certified as per international norms, face shields for our staff and doctors, gloves, all of them have become kind of our routine attire, daily attire now. In eye care, we are at a higher risk because we need to get closer to the patient's face. So we need to be extra careful when we equip ourselves. We have procured thermal recording devices, scanners, to help screen every single patient walking in to make sure that he or she does not have fever or any other symptoms. We are also ensuring that the patients as well as the attenders do their sanitation right at the entrance, sanitizing their own hands right at the entrance of the hospitals to save distancing within the hospital. We have arranged for regular cleaning of the various points, frequent periodic cleaning of all the touch points within the hospital. Even there have been changes in the equipment so that in between two patients we are able to clean the equipment as well. But we at Sankara are clear. We have done our homework. We have clear SOPs for the new normal. We are ready to restart. The new protocols and the fear among the general public would entail that we would not be able to see the full capacity of patients as we used to do earlier. We expect to see around 50% of our projected numbers for the present. It will take anywhere around 9 to 12 months before we can reach the normal numbers as far as our OP and inpatients are concerned. But until then, we need to sustain and stand firm during these trying days. Our strength has been Team Sankara, dear friends. Our staff, our administrators, our optometrists, our vision care technicians, our field workers, our doctors, our senior consultants, our chief medical officers, all of them, and those who have helped us diligently to provide world-class eye care so far, all of them, they are our strength. Today, We have around 1,500 employees at Sankara. All are full-time, totally dedicated to the service of the cause. All of them, as well as their families, or the extended Sankara family, and it is our responsibility to take care of each and every one of them. During these difficult days, we need to ensure that they are taken care. I am proud to say that despite the hardships at Sankara, so spontaneously, every employee donated one day's salary to the government's COVID fund, and that speaks volumes. We have been extremely conscious of the changing times. We have been proactively reaching out, reducing the inventory in the system, having a moratorium on capital expenditures like building and equipment, a cap on the additional human resource which might be required for the present or the future. Further, we have even looked at a pay cut for those at the senior cadres of employment in order to ensure that there is quality with frugality. Friends, it is indeed heartening to see Team Sankara rising up to the call, to take the challenge with optimism. The whole team is ready to bring the best in them for their cause and their institution. All these additional requirements, the guidelines to be followed, the additional expenditures which need to be incurred, coupled with lesser amount of expected output this year, dear friends, Sankara needs your special support during this year. A COVID emergency fund will be the need of the times. Once we sail through these days, Sankara will continue its promise, where we ensure that no one is needlessly blind in our country. We seek your support. The cause beckons. Together we gather strength to successfully face the challenge. Tough times will build a stronger team. Thank you very much. Namaskar. Jai Hind.